Immunotherapy for infectious diseases. Immunotherapy for infectious diseases. You're listening to a Drug Discovery News reading of Immunotherapy for Infectious Diseases, presented by Hakeem Ali Bokus Alexander on Noom Vibe and Spreaker, presented for World Reading Club in association with HAKEYM News and UniquilibriuM. This edition's reading focus comes to us from Drug Discovery News and is titled Immunotherapy for Infectious Diseases. You know, I really like this article here, how it's presented, because they're using a little bit of it's like some scare tactics in the advertisement for this poster. So you get these posters if you work in a lab, or if you're in the scientific field. A lot of times you get posters that I suppose they're a lot like, what were people calling those things? It'll come to me. It's not important right now. But in this particular poster, let me see if I clicked away from the page, right? The ad that I saw for it when it came into my email, it's like this shock and awe, and it says, pathogenic assaults lurk around every corner, from bacteria on surfaces to airborne viruses. Using immunotherapy for infectious disease treatment leverages the immune system to do what it does best: defend against pathogens. It sounds so militant. And then, then it asks to download this poster from Drug Discovery News to learn how scientists use immunotherapy to neutralize pathogens and mitigate infectious diseases. And at the top of, so the title is Immunotherapy for Infectious Diseases, and it says the main topic here, the main point they're making is that many of the same therapies used to activate the immune system against cancer may also combat infectious diseases. All right, so, and then I got the little poster, and the cool thing about it is that since I already downloaded the PDF, if anybody goes to my site, World Reading Club, when this is done, and they'll be able to look at the poster and download it. As a matter of fact, you know what I'm going to do? I'm just going to publish this right now as it is, because I can always update it later, because then it'll make it easier for me to read the poster. It's really short. All right, view post. Let's see. Let's take a look at this, how it came out. That's nice. All right, so this poster here, I'm going to go to I'm going to open it up here. 2-page view. I don't need a 2-page view. So I'll go here and open it up and see what kind of advice are these lab researchers getting about, wait, where did it go? Oh, there we go. Vaccines for infectious diseases. Okay, so on the top of this thing here, what do we have? Immunotherapy for infectious diseases. Let me get some zoom in on this a little bit so I can see a little bit better. All right, what are they talking about here? Immunotherapy for infectious diseases. All right, the first little block here says humans are surrounded by pathogenic assaults. Oh, there's that shock and awe again, right? That was, so that this must have been where they got that excerpt from to draw me in here. Drug Discovery News. Humans are surrounded by pathogenic assaults, from bacteria that lurk on surfaces to airborne viruses that infect the respiratory system. As the world grapples with the ongoing pandemic, researchers focus on the body's first line of defense, the immune system. Immunotherapy is typically thought of in the context of cancer treatment, but many of the same therapies used to activate the immune system to treat cancer may also combat infectious diseases. These therapies fall into 3 broad categories: engineered T cells, therapeutic antibodies, and the activation of endogenous T cells. All right, where should I start? This poster. All right, so let's see. I'll go to the left side first, where it says therapeutic monoclonal antibodies, and there's a nice little line going down to a person right on their arm, in line with their armpit, and there's a syringe sticking into it. See, and it says, okay, so therapeutic monoclonal antibodies. And again, if you want to look, I already published the blog that I'll embed the podcast in on the website, so you can look at the poster. I love these posters; they're always so pretty. They're great. All right, so let me get back to that poster. So let's take a look here. How is that? Oh, there we go. All right, so therapeutic antibodies are perhaps the most versatile immunotherapy treatment. Researchers use vaccines to supply therapeutic antibodies or stimulate the production of therapeutic antibodies through various mechanisms, including in introducing a dead or attenuated virus or the RNA sequence for a viral protein. Monoclonal antibodies have neutralized the Zika virus, Ebola virus, and in some cases, SARS-CoV-2, and are considered the treatment of choice for many bacterial pathogens. And then we've got a monoclonal antibodies neutralize antigens on the surface of viral and bacterial pathogens. Very nice. Okay, so this is really great. I like the images are simple but effective. All right. Molecular engineers may conjugate monoclonal antibodies with small molecules, toxins, and other biological agents to ensure their targeted delivery and efficiency. And that's all under the category of therapeutic monoclonal antibodies. All right, what's next? Let me just go straight across the top to the right of that. And because these things aren't numbered, so I guess I can look at it anyway. So this is cytokines. Cytokines, and that has an image. The line is pointing directly to, looks like the heart area. And it says, physicians administer pro-inflammatory cytokines to activate T cells capable of destroying pathogens. However, with SARS-CoV-2 infection, macrophages and T cells may produce too many cytokines, resulting in a cytokine storm. In such cases, physicians administer immunomodulatory drugs such as tocilizumab. Is that what it is? Tocilizumab. Yeah. It's either tocilizumab or tocilizumab. I'm going to say tocila. Sounds like Godzilla. Tocilizumab to decrease cytokine production. All right. And since this next part of the poster is right underneath it here, it's kind of, I think the way that this image is created is kind of driving my reading flow, at least for me. All right, the next part is engineered T cells. Engineered T cells. Researchers genetically modify patient-derived T cells to express chimeric antigen receptors, CARs, C-A-R-S, chimeric antigen receptors, CARs, and return them intravenously into the body, where they preferentially target specific pathogens. Bi- and trispecific CARs prevent HIV infection while efficiently killing HIV-positive cells in mouse models. CARs specific to cytomegalovirus, CMV, have also been described. 2 ongoing clinical trials are exploring the ability of CAR T cell therapy to eradicate latent HIV reservoirs in humans. Researchers may also use adoptive cell transfer, where they manipulate and expand T cells ex vivo to combat the Zika virus. What's my email going off on me for right now? Toyota. Where is that? Oh, that's in California. Keys, Van Nuys. I used to remember the commercials when I used to live there. Yeah, that's Van Nuys, because I had my car serviced there when I was there a little while ago. All right, so let's take a look at the next thing here. All right, engineered T cells. Moving on. The next one is checkpoint inhibition. Checkpoint inhibition. So similar to cancer cells, dysfunctional T cells infected with Mycobacterium tuberculosis aberrantly express inhibitory receptors such as PD1 and PDL1. These receptors bind to functioning T cells and dampen their ability to recognize and destroy diseased cells. That reminds me of something in psychopharmacology, which is the so-called neuroleptics, which literally means nerve seizing, and those are what they call the antipsychotics, and they are what's known as dopamine agonists. So this artificial dopamine-like molecule that are created and used for these antipsychotics, aka neuroleptics or nerve-seizing drugs, they occupy the dopamine receptors, and that prevents the endogenous and natural dopamine, biological dopamine, from being able to attach to the dopamine receptors, and because of that, the dopamine is not able to activate and cause the effect that dopamine normally would in the body. And this is saying that cancer cells, these dysfunctional T cells infected with Mycobacterium tuberculosis, aberrantly express inhibitory receptors such as PD1 and PDL1. And these receptors bind to functioning T cells and dampen their ability to recognize and destroy disease cells. Checkpoint inhibition therapy administers antibodies that bind to these inhibitory signals, allowing T cells to identify infected cells. While revolutionary for cancer, checkpoint inhibition for infectious disease is still under investigation. And all of this has our numbers for references at the bottom, but I can see going on here. This cell, yeah, it's definitely not allowing blocking. All right, so next one, I already went to engineered T cells. Yeah, so now the last block here is bispecific antibodies. Bispecific antibodies bind two separate targets: an antigen on the diseased cell, and an antigen such as CD3 on a cytotoxic T cell. By binding both antigens, bispecific antibodies bring disease cells into proximity with immune effector cells, where they can be promptly eliminated. Researchers engineered a bispecific antibody that neutralizes the Zika virus and prevents the generation of resistant mutant strains. Clinical trials investigating the ability of engineered bispecific antibodies for Pseudomonas aeruginosa and Staphylococcus aureus bacterial pathogens are also underway. Such treatments may prevent bacterial pneumonia in high-risk patients. Woot, Drug Discovery News. All right, and that comes from Drug Discovery News on a short poster titled Immunotherapy for Infectious Diseases. And again, their wonderful tagline that brought me in, their clickbait, in the email said, pathogenic assaults lurk around every corner, from bacteria on surfaces to airborne viruses. Using immunotherapy for infectious disease treatment leverages the immune system to do what it does best, defend against pathogens. And that was a really great poster. I actually really enjoyed looking at that. So you can find that on worldreadingclub.com right now. You can look at the poster for yourself if you're as excited about geeky things like that as I am. And then in just a moment, this replay link here directly on Noom Vibe will be posted in that blog post as well. In addition to, depending on how the sound comes out, if I have to do this again, the Spreaker link to this audio as well. All right, you've been listening to Immunotherapy for Infectious Diseases, a reading from Drug Discovery News by Hakeem Alipokis Alexander on Noom, Vibe, and Spreaker, presented for EYM News in association with World Reading Club and UniquilibriuM. And hello, Terry.
Easy for you to say, Hakeem.
What's that?
Easy for you to say. I do admire you for trying to pronounce some of those long scientific words. I would have gave up, I think.
Well, it comes with reading them every single day, and for years.
I'm sometimes I'm not word dyslexic. I think I'm some speech dyslexic sometimes, trying to pronounce some of these words. But what I will say is something that struck me while you were talking, and you were constantly talking about pathogens and bacteria on surfaces and things. And what struck me is how we seem to want an antiseptic environment, like parents always got to wipe down the surfaces with this very strong chemical formula, which probably the smell of it alone does you more harm than the bacteria ever would. And I do wonder why people are more prone to diseases these days, because when I was young, we were exposed to all kinds of bacteria. I used to play in the back garden, put dirt in my mouth and spit it out, and all kinds of horrible nasties, but it builds up your natural immune system and resistance, And the other thing I heard recently, now I wasn't really aware of, that cancer, we have cancer in our bodies quite regular, but our natural immune system gets rid of it, nips it in the bud. Was you aware of that?
Yeah, cancer is always in the body. Even something that you're going to hear that a lot of people don't know about is some people just have the ability in their body to attack the cancer formation quicker than it is able to form tumors and things like that. And it just depends on the balance in your body, various different factors. But yeah, it's ever present. It's all over the place, all the time. It's within everybody. And one of the things is, of course, that now, okay, so one of my favorite bands from back in the day released an album in 1993 called Sepultura, and they had this song, and the lyrics are very interesting. It says, biotechnology ain't what's so bad. Like all technology, it's in the wrong hands. Cutthroat corporations don't give a damn when lots of people die from what they've made. And it's called, the song is called Biotech is Godzilla. And and that's really one of the main things is, it's well known that exposing yourself to pathogens and things like that, kids playing in the dirt and the soil and outside and all that stuff like that, helps your body to prepare. See, this is what's so funny, is that playing outside and getting a little dirty, of course, I'm not suggesting swimming in the sewer, right? But just playing outside with the dog, running, walking, all that stuff is the same exact effect that scientists and biologists are doing when they inject us with the so-called inoculations. It's the same
Yeah.
effect. What they're doing is
Yeah.
introducing to a small amount, or as they say, attenuated pathogen, um, in order for your
Yeah.
body to start to express the type of immune defense that it needs that it wouldn't normally uh, encounter. And so it just prepares it, and that's what playing
Yeah.
outside stuff you were saying. But
I've never.
nowadays,
Yeah.
yeah,
I've had a COVID. I had 3 COVID jabs, right? And I've never had a flu jab in my life. But um, I've heard lots of anecdotal evidence of people having a flu jab and then a week later getting the worst flu they've ever had. How does that work?
yeah. Well, I have an interesting story about that too. As a trainer in California, one of my clients, flu season came around, and she was telling me, "Hey, get your flu shot, get your flu shot. Flu season is here." And I didn't, and she did. And the next time I went to go see her, she says, "Oh, Hakeem, I don't know if we should train. Is I have the flu." I said, I'm fine. I trained with her. I didn't get the flu. She
Yeah.
she did, and she got the flu shot. So go figure. I
Yes.
don't ever get flu shots and don't get the flu. She got a flu shot and got the flu within 3 days of getting. I mean,
Yeah. I just find it interesting, because I'm not trying to claim that there's some malintent going on, but all I will say is it's very strange. If you do the research and stuff, you do hear these stories, and it just makes you scratch your head sometimes. But I don't know. These scientists are paid a lot of money, and one, of course, some of the biggest companies and conglomerates in the world, of course, are pharmaceutical companies. And if you think about it, if we all sort of like found natural remedies and used preventative methods to stop us getting ill, they wouldn't be in business very long, would they? Yeah. So
I think
anyway,
that it's simply, it may be anything malicious. Uh-oh. Hold on. That was interesting. But just that, you know, everybody's not playing with the best information they possibly can. I don't know. Yeah, I don't want to jump to any conclusions about anything like that either. It's just interesting. And the one
it
thing
is
with immunotherapy,
interesting.
as you know, that
Yeah,
everybody's different. So not everybody,
yeah,
like maybe for example, I can go around playing in the dirt, being outside and being exposed to things by different people, and my immune system will do just fine.
yeah,
But it may be that
yeah,
other people need to have the inoculations and the different types of vaccines and things like that in order for theirs to
yeah,
kick in. Everybody has a different
yeah,
level, just like it's well known that not all of the different drugs are metabolized by people's bodies in the same way, simply because in the liver, everybody has a different expression of a certain enzyme called the CYP450 enzyme system, which metabolizes
yeah,
the xenobiotics or foreign substances differently in everybody. And that's just the way it is. We're all different,
yeah,
period. And
yeah.
the science
Uh,
will tell you that too.
yeah, I mean, I rarely get headaches, Hakeem, and even if I am ill, it's normally I sort of shrug it off within a few days. And believe it or not, I haven't, apart from COVID, I haven't had a day off sick at work for 12 years. And I'm in my 60s now, so it's going to catch up with me eventually, but maybe it won't. Touch wood. I don't
Yeah.
know. I must be doing something right, but all I will say is healthy diet within reason. And so sorry, I was thrown out of the room. I'm back.
It's all good. I was wondering what happened. Everything went to silent for a minute.
No, I was thrown into another room. That glitch that happens, or it used to happen to me a lot, quite regular. But yeah, so
Yeah.
I've forgotten where I was now. Oh yeah, yeah. So no, I do believe in nature is wonderful. Now, for providing everything we need to stay healthy, and of course, some people like fast food and sweet things and things like that. But you can have them, but in moderation. I'm no saint. I like to have a few snacks here and there. But, but yeah, I just find it interesting that you've got in America you have stinging nettles, don't you? We have them in the UK. You,
What is
you
that?
know the weeds. You know the stinging nettles. You know the weeds with
Oh
the
yeah, yeah,
points on them.
yes, stinging nettles.
Yeah.
Yes.
Now, normally growing quite close by is a very large leafed plant called a dock plant. Well, I know they're called dock leaves. And I always remember my uncle and my dad telling me, "Oh, watch out for them stinging nettles. But if you get stung by the stinging nettle," he said, "grab one of them dock leaves there and rub it on it, because it's like, I think it's like acid against alkaline, that kind of thing, and plus whatever properties that dock leaf has, and it almost like within a few minutes it would reduce any stinging, and you'd feel a lot better, you know."
Mm. So it just neutralizes. So it, it,
Yeah,
the answer to the problem is right there. The solution is already present with the dock leaves. I mean,
that's right. Yeah,
I would reckon to guess that that is the case in a lot of things. The solution is closer than we think.
yeah, and I don't know, it's I think science is still um, science is great, and it knows a lot of things, but it's science is always suddenly realised that the way we've been doing things for decades is suddenly maybe not the right way to do it. So anyway, you live and
I
learn,
don't.
and always stay curious and use your intuition at the end of the day. That's what I
Yeah,
say.
for sure. I don't think that there's anything wrong with the scientific method per se. It's just in the way that everything is so compartmentalized, and how spirituality, science, psychology, and all the different fields are sort of pitted against each other. There was a
Yes.
movie many years ago. I don't know if you've ever heard of it, called Lorenzo's Oil.
Yeah. I don't think I've ever seen it, but I do. It does ring a bell. I have heard of it. Yeah, yeah,
So in that movie, one of the things that I found interesting, and that I actually was able to extrapolate in an analogous way from a biological mechanism, I also saw it as part of a communication breakdown as well. And so the movie was based on the premise of this disease that this boy had. His name was Lorenzo Michael Murphy Odone, and he had something called adrenoleukodystrophy. And
okay.
adrenoleukodystrophy is in a similar category to multiple sclerosis and other diseases in which the body attacks itself and it
Yes,
breaks down the myelin sheath. The myelin is the white fatty substance that surrounds the nerve cells
yeah,
and helps to drive the impulse and the nerve signals from one to another on the dendrites.
yeah.
And what they found was that by introducing certain fatty acids into the body, they were able to trigger a process called competitive inhibition. So what was discovered by his parents, and they went to the library and did all this research on their own, was that when and so the competitive inhibition is something that I'm talking about. That's the communication breakdown. So in competitive inhibition in the body, they found that the reason why the myelin was being destroyed was that a certain very long chain fatty acid was getting into the body, and it would build up in the brain because a certain enzyme wasn't breaking it down. It was making so much of it, and when it got into the brain, it destroyed the myelin that was on the nerve cells, and eventually it would break it down so much that it would eventually lead to paralysis and also all kinds of loss
Wow,
of function and death within 2 years of diagnosis of the disease. But they
wow.
found that by introducing oleic acid that comes from olive oil and erucic acid, which comes from the rapeseed
Yes,
plant, we'll know it as canola. Although interestingly enough, canola, little trivia, is actually a short version. It means Canadian oil, and it was developed in 1974 in Canada as
yeah.
an industrial lubricant. So it's actually not even, there's no such thing really as organic canola oil, because it's rapeseed that was genetically modified for a different purpose. Anyway, back on track
Oh,
though, is that they
yeah,
found that by introducing erucic acid and oleic acid into the body, that it would cause the one enzyme that was elongating what they call the bad fats, and it would have a competitive inhibition. It would, if they overloaded the body with these good fats from the olive oil and the rapeseed, it would cause the enzyme to compete to elongate those which were harmless in the body.
Yeah.
So the more they gave them, it would cause a competitive inhibition of the elongation of the bad fats. And
Yeah.
so, but in the same way, is that all these scientists around the world were competing with each other, and who's going to be the first to find a cure for this and that
Yes.
it was inhibiting the flow of information to everybody's different labs, because everybody was being so secretive that they weren't sharing
Yeah.
information. Where the parents of this child, because they were looking for a cure and they wanted to save their son's life, they were going to different laboratories, different libraries, different research, and they found that all these different scientists around the world had different pieces of the puzzle,
Yes.
but they were inhibited through their competition because of the fact that they're so secretive. And
Yeah.
but held these conferences and brought everybody together, and then they were able to find the way, a treatment to slow down the adrenal
Yeah.
leukodystrophy and liquidation of the myelin. And that's one of the things that happens also, is
It doesn't
that,
surprise me. It doesn't. It's all about the dollar at the end of the day, and who's going to come up with it first, so it could be patented and make a few people very rich. Yeah.
but yeah, but now if anybody, since I went on that, if anybody ever wants to look into that, there's something called the Myelin Foundation. Lorenzo's father started it some years ago, and I would suggest anybody really go look at that movie, Lorenzo's Oil. It's a fascinating film. It was written by a physician also who turned screenwriter, and so it's medically accurate, and it's a really great depiction. They even talk about, one of the things that, like, why did the different treatments for AIDS get pushed so quickly?
Yeah.
Because people got together and so on and so forth. It's a really great film. And also,
See,
yeah.
yeah. I just want to say quickly, Hakeem. See, if we put as much energy and resources into, coming up with this kind of research you've been talking about, instead of like the next atomic weapon and weapon that can, kill as many people as possible. The world might be a better place, mightn't it? But again, I suppose I'm an idealist at the end of the day. But
Well, you're not the only one. Have you ever heard of
yeah.
Linus Pauling?
I haven't. I don't think I have anyway.
So there's even a school in Oregon State University called the Linus Pauling Institute, and he's the only person to ever win two unshared Nobel Prizes. One was the Nobel Prize in, I think it was in physiology and medicine, even though he was a chemist, because he found the chemical process that causes sickle cell anemia, so therefore was able to advance treatments and therapies in sickle cell anemia, because he found
Yeah.
the oxygen deficiency that was causing the twisting of the blood corpuscles, and so he won a Nobel Prize for elucidating the process that was causing that. He also won the Nobel Peace Prize because, like you mentioned about, if we'd spend more time looking for cures and things like that rather than building atomic bombs. Well, he won the Peace Prize because, as a chemist, he was able to demonstrate the problems with nuclear weapons testing and the fallout that happened for it. So
Yeah.
he used science to advance more peaceful measures to stop the testing of atomic bombs and things like that. So, and he also was the pioneer of something called orthomolecular medicine, which he wrote a paper in 1968, I believe, called Orthomolecular Psychiatry, where he presented the idea that varying the concentrations of substances normally occurring in the body may prevent and control and treat mental diseases, and even demonstrated that, for example, diabetes is an orthomolecular disease because you have to vary the concentration of insulin to control that, and that phenylketonuria, all these different things. I mean, a brilliant guy, but
Yeah.
he was an idealist too. I don't think it's too much to be. Idealism can also, and my very long-winded point being that being an idealist can lead to great things. This guy won two Nobel
Yes.
Prizes.
Oh, definitely. Yeah, definitely. And we need a more holistic approach to this sort of thing, and consider, things that were considered woo-woo, like sound therapy, frequency. Physics will be the medical treatment of the future. I deeply believe that. because we know that certain kinds of sound waves can cause devastation. You know, you ever been standing to a loud PA in a nightclub or a band, and you will know that those deep booming things will make you feel very ill if you stay close to them for too long. So yeah, you know,
Well,
frequency and yeah,
like you were talking about earlier about the plants and how the difference, even though I'm a big fan of death metal, but you mentioned in your talk earlier how like the plants don't
yeah,
thrive as much when they hear
that's
like
right.
certain heavy metal music as
Yeah,
much as others. But I don't know if you ever heard it, but somewhere in my 1,000 talks here on this platform formerly known as Wisdom, there was one where I did a science fiction talk based on science fact, of course, because that's where science fiction should
yeah,
come from, about how
yes,
you can use sound frequency to completely destroy an entire planet
yeah,
using resonance. They even
that's
have
right.
therapies that physicists have been using to tune into the frequency of the shell of a virus. Some
Yeah,
physicists at Arizona were able to what they call sound the death knell of the virus by
yeah,
shaking it to death, by tuning into its frequency, in the same way that
yeah,
it's been demonstrated that an opera singer can shatter a glass by tuning into its
exactly.
frequency.
Yes,
Um,
yeah,
and there's all kinds of scalar resonance things like that. I created a frequency that I posted on one of the podcasts in order to, when I found out what the frequency of was of the shell of the coronavirus, and then some scientists in India had published a frequency, so I created a binaural beat frequency and some isochronic tones to
oh,
tune into that frequency. But yeah,
there
I
you
mean,
go.
sound frequency can
This is the
be
future.
destructive. Yeah.
Yeah, no, this is the future. People thinking outside the box, and you know, I do believe that will be the future. And so great to talk, Hakeem. And I've got a friend here who wants to send you a message. Oh,
All right.
you want to say it now? Okay. I think his name's Mr. Spock. Here we go.
Live long and prosper.
Thank you, Hakeem.
Thank you, Terry. But you know that also reminds me of, it's not even a new idea. The sound frequency. Some people have heard of Royal Raymond Rife, who I believe was ostracized from the medical community because he had like a Rife frequency generator that he said could tune into the frequencies of diseases. Hulda Reger Clark, who wrote a book called The Cure for All Cancers and the Cure for All Diseases, which ironically enough, she died of cancer. Some conspiracy theorists would probably say that it was like a hit down on her in order to kind of disprove her theories. And various other people, including these physicists. I think Stankey was one of his name. It's published on my podcast somewhere, but it's not like it's something that's completely unknown, and that destructive force. I mean, even something that people that's used quite often in medicine. There's something called lithotripsy. Lithotripsy, litho meaning stone or rock, and tripsy meaning to destroy, is using sound waves targeted at kidney stones to break them up into smaller pieces in order for them to be able to pass through the urethra for people who have kidney stones. So it's not uncommon to use something destructive like tuning into the sound waves to shatter or break something down for it to have a curative effect. So, however, that is man, I get going. I start using my freaking law of association. My brain just starts going off on all this. There it is. What was this called? I was talking about immunotherapy for infectious diseases. The blog is up on the same name on worldreadingclub.com. This audio will be up there, as well as the poster that I got from Drug Discovery News. So again, you've been listening to Immunotherapy for Infectious Diseases, and a nice conversation there with me blabbing to Terry about all my interest in all things science. This was for HAKEYM News in association with World Reading Club and UniquilibriuM. And thanks for those who have passed through the room or stopped to listen for a spell. Jonah with the blue collar, Queen of Forgiveness, Ross Lund, of course, Terry for coming up, Megan Thomas, Lois Hampson, Doobie, Eddie Wardy, Jenner, Fiona Litt, Cecilia Grace, hello, and Jason Moore. Till next time, stay well.